So, if you're looking to lose weight and you're wondering if intermittent fasting is a good option for helping you to lose weight, the answer is it's going to depend on whether or not you have insulin resistance or not. So, insulin resistance or hyperinsulinemia with dysfunction in some insulin receptors occurs when you have had high insulin over a long period of time, and when you have insulin resistance and some of those receptors are not working, it makes it difficult for your body to actually properly utilize glucose. So it can lead to diabetes. So you have high glucose in your bloodstream, so hyperglycemia, and then that leads to diabetes. Okay. Now, so many people are insulin resistant, but they're not at the point yet where they're hyperglycemic or they're diabetic. And so when you're at that stage, I want to call it like the in-between stage. That's usually the stage where you tend to accumulate a lot of weight because you have so many excess calories or glucose in your bloodstream and it's just getting shoved into your fat cells. If you're insulin resistant and you try to do intermittent fasting, what you're trying to do is you're trying to get your body to burn fat for fuel. And that's going to be difficult if you're insulin resistant because insulin resistance basically kind of locks the gate to releasing your fat cells, right? To releasing fat from your fat cells. And so whenever someone's talking about insulin intermittent fasting, it is a great tool for weight loss, but you need to know where to place it in weight loss. So the first goal with losing weight is going to be making sure that your body, your nervous system is in a good place to lose weight. Okay, so think of it this way: if you're stressed out, your cortisol or your central nervous system is out of whack, and that system is telling your body to put on weight. It's not telling your body to lose weight. So if you're chronically stressed, that's one thing, or you're going through some form of trauma, or like you're ill, your stress levels are high, your body is making you gain weight, and it's making you gain weight in your stomach area, in your visceral fat. That's the dangerous fat. Okay, so you first need to make sure you regulate your nervous system, and that's just the central nervous system. The other part of your nervous system that needs to be regulated is your gut microbiome, or we call your enteric nervous system, because that ecosystem is very similar to the ecosystem or the nervous system that's in the brain. And if you're eating foods that are high in sugar or processed foods, you're creating a dysregulation in the gut microbiome, and that in itself is going to create a lot of cortisol and other stress hormones that's going to promote inflammation and all of that. So before you ever go trying to bring insulin levels down to help you lose fat, you need to first make sure that your nervous system is on point and it's regulated. Then you can work on trying to use intermittent fasting as a way to lose fat. So if you're interested in losing weight and you're in the DC metro area, you can join my practice. I have a weight loss clinic that's virtual, or you can purchase my weight loss course as well, which is in my bio.